Good morning. I'm Brian Johnson with Oregon Public Health Association. I'm the president of the current board of directors. And we are here in Salem today, about 150 strong, representing a membership of over 550 public health professionals across the state of Oregon. The Oregon Public Health Association is an affiliation of the American Public Health Association. And we serve really a couple of primary missions. Our primary goal is to provide learning opportunities for public health professionals across the state of Oregon, but as well as also to advocate for public health policy across the state. And in particular, we're here this morning because we want to make sure that it is known to our local representatives the role of public health, and to make it known that there really is a lot that can happen simply by the role of policy, and the role of policy in impacting many folks, not just individuals, but entire communities through policy can impact health. And in fact, it's important to think of all policies as health policy and the potential implications of health. We know that healthy communities are strong economically, are livable communities, are resilient and interconnected, and that all of these factors together really impact where people create the places, and the policy can create places in which people can be healthy and where they live and where they work and they play and be active and live long and productive lives. So the Oregon Public Health Association is here speaking on behalf of public health. We spend our time advocating on behalf of public health throughout Oregon, providing opportunities for networking and learning among public health professionals, and providing a voice in the field of public health. We advocate for just and equitable health policies, partner with other organizations to really build coalitions and provide a voice for public health throughout communities, and sponsor Public Health Legislative Visit Day, which is what we're doing today, as well as putting together an annual meeting of public health professionals that happens every fall. It brings together professionals from all over the state of our 550 plus membership and beyond who come to attend that session every year. And that really culminates our activities throughout the year. We have a number of standing committees and special interest groups which serve our membership, and many of them include public health nursing folks, epidemiologists, academicians, so from university settings as well as schools, and health nurses in those settings, adolescent health, and disability health throughout the state of Oregon. So Anna, if you wouldn't mind speaking about what we're up to today, that would be great.
Hi, good morning. I'm Anna Stiefvater. I'm the chair of the policy committee for the Oregon Public Health Association. As Brian said, we're here today to advocate for public health. And the Oregon Public Health Association's two sort of overarching legislative priorities are policies that support the reduction of the two leading causes of preventable death and disability in Oregon and nationally, which are tobacco use and obesity. Tobacco use continues to be the leading cause of preventable death in Oregon. We know that almost every chronic disease is either caused by or made worse by tobacco. Tobacco contributes to over 22% of all deaths in Oregon and costs taxpayers more than $2.4 billion a year in direct medical expenses and lost productivity. Obesity and its related complications is the second leading cause of preventable death in Oregon. The Oregon Public Health Association works to support healthy nutrition and increased opportunities for exercise. Preventing obesity lowers the risks of diabetes, heart disease, stroke, high blood pressure, stress, and depression. Children and adolescents who are obese are at increased risk for becoming obese adults and really setting themselves up for a lifetime of health consequences. In addition to those two overarching priorities, as Brian mentioned, many of our members are here today to talk to their legislators. Some of them are wanting to talk about specific legislation that's up right now in February. OPHA has endorsed a couple of bills, and we're talking to our members about those today. The first is Senate Bill 1551, which we see as a bill that will really close the loophole in our background check system so that it would require a check on all gun transfers other than to immediate family members. we see this as an important public health priority. Other states that have firearm laws have a lower risk of fatalities from firearms for suicides and homicides. So we think this is important, and our members are going to be talking to their legislators about this today. We also have endorsed Senate Bill 1569 that would require the Oregon Health Authority to establish and maintain a list of designated high-priority chemicals of concern for children's health and that are used in children's products. We know that our federal laws are not protecting children from toxics. Chemical ingredients are not fully disclosed to consumers or health officials. It's important for us in public health to know how and where people are exposed. So we see this disclosure legislation as a first step towards decreasing exposure to chemicals. The third one is the portions of Senate Bill 1577 that require police and sheriff departments in Oregon to adopt a formal policy on how to respond to a case of missing vulnerable adults. This legislation is really meant to help the sort of growing number of people in Oregon that have Alzheimer's or dementia. We know that wandering is a problem for this population, and this legislation really sets up policies to help this vulnerable population. So those are the issues that OPHA is here at the Capitol today to talk about. Our members are meeting with their legislators now. Thank you.